Hey folks, Dr. Santander from Oahu Holistic Medicine. I have a list here of like 350 uh, questions, frequently asked questions about acupuncture and new stage of medicine. So I'm going to do my best to answer as many of those as possible. But first, I want to start with the most exciting, the most craziest one that I've found. Uh, Hold on, it's about death. Can acupuncture, can you die? Can you die from acupuncture? It's a perfectly reasonable question. Um, I just don't get asked that question a lot, but I totally respect it. And the answer is it's almost no. It's almost no, with the exception of um, maybe this dog wants to get in on the call. There's a condition called what is it called with the lungs? Pneumothorax. Pneumothorax is a puncture in the lungs, and that can be potentially life-threatening. There are negative consequences to acupuncture. There's negative consequences to any medicine, uh, unfavorable consequences. And so it is possible, but it is so rare you almost never hear about it. I think 1 in 10,000 acupuncture people who go to acupuncture will have or report a pneumothorax. And even if they do, it doesn't. It's not usually life threatening if you go to the hospital. I mean, it can be life threatening, but it's not usually fatal if one goes to the hospital. So that's the worst of the worst. And we're just going to go down the list, and I'm going to do my best to just rip and run and answer as many of these as I possibly can. And so if you've ever been considering acupuncture, and I'm going to hope to hit so many that this either resonates true for you or resonates true for a loved one, that this is a modality that can probably help you in some way or help somebody that you know and love. So let's see. Can it there's one here that says can acupuncture stay open? I think what they mean is like can a wound stay open, like the point where the needle was inserted, and the answer is like yes, kind of. They talk about in the some of the classical literature about leaving the aperture open to vent heat, inflammation, stuff like that. And if you're an MD and I've already lost you, then I'm sorry. I think you found the wrong channel. That's just kind of classical literature. It's out there. It exists. It's a concept that exists. I'm not necessarily talking about germ theory. Now I'm talking about germ theory. So can like if that question is wondering, can somebody get an infection from acupuncture, from an acupuncture wound remaining open? Like we don't put band-aids over people for the sites of the acupuncture. The idea being that the skin just closes back around and there's nothing. There's really no viable entry point. The amount of people who have gotten infections from I don't have the statistics from acupuncture needle. I've never seen it in clinical practice. I've never seen it in our student clinic. I've never heard of a story from it happening from an elder practitioner or a master teacher practitioner has taught me. Very, very rare, if at all, will somebody get an infection from a needle poke. Um, let's see. Can acupuncture work for anxiety? Definitely. Depends on the source of the anxiety, depends on why. There's lots of factors to it. But if you have anxiety and you want to go to an acupuncturist for that, or a traditional East Asian medicine doctor for that, that's a very great starting point. If you're starting, or it could be great at any point in the journey. If you've been on medication for a while, if you're just starting, want to do something about your anxiety, want to get under control, totally recommend it. And you might need to shop around. And that's just kind of a disclaimer for any of these going down the list. Someone's got a super loud radio. Life in the big city. Sorry about that. It's a disclaimer here. Acupuncture works for so many things, but it's got to be the right acupuncturist to treat that thing, right? Much like in modern medicine, right? Can somebody treat my kidneys? Can somebody treat my stomach? Are they specialized? Are they well trained? Do they know what they're doing? Do they have teachers who brought them to the next level of speciality in those things? Or are they more generalized? And not that one is better or worse. Just who are you seeing for that? Are you seeing somebody with luck treating anxiety? Are you seeing somebody who's new to the game? All that plays into it. Can acupuncture cure back pain? As we've talked about before, this is going to be another disclaimer going through. Cure is a funny word. because one can never necessarily get back to factory normal. Like I don't have a back like a 5 year old or a 3 year old. Like I'm never going to be fresh out of the womb again. I've had a lot of work done on my back with acupuncture. It's given me tremendous amount of relief, but it will never go. It's only going to get back to as good as to optimum playability, what I like to call optimum playability. So a little story about that. I like playing guitar. I like music. I've always loved music. And especially since I was in high school, I was like, God, I got to play guitar. So I went on this crazy guitar journey for about 15 years. And kind of came to a head I was living on Long Island in New York at the time. I went to this, maybe it was in Baldwin. It was a music store. I was living in Long Beach at the time. And I go into the music store and talking to the guy, he's trying to sell me some more stuff. I don't have any money, so I'm not buying. And he says, feel free to bring that cool guitar that you're talking about into the shop and we'll do a setup on it. And I was learning how to do setup is like where you get the guitar to play as good as it can possibly play. And he says, we take these guitars, any guitar that comes in, our master technicians bring them to optimum playability, which I thought was so beautiful because over time wood warps and twists and gets cracks and the dryness of it changes and the bend of it changes and the tonality of it changes. So all of that is part of the natural aging process of a guitar, but they get it to the best that particular instrument can possibly play in that particular moment. And I feel like acupuncturists, doctors, Chinese medicine, we do the same thing. We try to get one back to a place of optimum playability, optimum livability. So cure, as in fix forever. I mean, if cure implies one will never have back pain ever again, then no, acupuncture cannot cure somebody so that they never have back pain ever again. And obviously, it's not true that acupuncture can't help the body, can't help the back, can't fix the back for years and years and years. I had a patient who told me he got acupuncture once or twice for his shoulders. He was having like shoulder and neck pain. Once or twice he went in and he didn't have a problem with his shoulder and neck for 20 years. So it can do miraculous things. And the answer is like, the answer is kind of yes in regards to what you're saying. Like if you have chronic back pain, can the back pain be lessened so much to an extent that it doesn't interfere with your day-to-day life and with you wanting to live a great life and do all these magical and amazing things? We can get it to be so good. We can get it to be as good as we can get it to be. And that's more of a specific personalized conversation to be had. And it's really hard for me to generalize beyond that. So there's a disclaimer about the word curing, right? Can acupuncture cure you? It's a funny word. Some people have more finesse with it than I do, but it is what it is. Can acupuncture help one to conceive? Yes, scientifically proven, and it's also been proven in the absence of double-blind studies with thousands of years of empirical research. Acupuncture was one of the main modalities of medicine in China for thousands and thousands of years till the present day. Still to the present day, it is. Acupuncture irritate nerves. Yeah, you can acquire, if you find somebody who makes a mistake or doesn't know what they're doing, you can have an issue where your nerve gets irritated from maybe they hit a nerve when they go in and it stays irritated for a couple days, maybe a week. In the rare case, again, super rare. And I'm not just saying this because I want acupuncture to be the cool thing that is super safe and that everybody can do, because that wouldn't be serving the listener here. That wouldn't be serving you, it would be dishonest. But the amount of times where people have permanent negative or less favorable effects to their nerves, like numbness and tingling or neuropathy or lack of sensation from the nerves, the amount of time that happens is you almost never hear about it. Almost never hear about it. How can acupuncture help? That's super broad. It can help with almost everything except like a heart attack. This acupuncture falls under the umbrella of East Asian medicine, which has a lot of things in it, including qigong, which is like yoga, herbology, which is like internal medicine, like medications, diet therapy, which is like seeing a licensed nutritionist or something like that. So there's East Asian medicine can help almost everything. Not everything, of course. Like every medicine, every specialty has their limitations, but it can help so broadly, so many things. It's a very, very wonderful thing. So that's a broad question. It's kind of hard to answer. How can acupuncture help with pregnancy? It can help with the likelihood of implantation. It can help the retention of the fetus. It can also help with ease of delivery, and it can help many patients who have gone through acupuncture through their pregnancy have reported having really calm babies, which I think is really great. Can acupuncture help with anxiety? As we said before, yes. Can acupuncture help with weight loss? Yes, yes. It's a tricky game. There's more involved in it, like diet, lifestyle, exercise, genetics, all of which we can address and talk about at some point. But yeah, it can help with weight loss. How can acupuncture puncture your lung? It's pretty simple. Needle goes into the lung and then punctures the lung. No, how can acupuncture puncture your lung? Oh, so there's acupuncture points along the back, and I'm not saying this to make anybody freaked out or nervous when they go to the acupuncturist if they get needled over the lung at some point. All acupuncturists in the United States and in China, I'm sure, and beyond, are taught that you don't needle a certain way over the areas of the lungs. You don't needle with a certain depth, right? All of the acupuncture points in the body have a certain depth at which they're therapeutic and beneficial, and a depth at which they cannot be needled. And obviously, over the back, over the chest, over the lung area is very shallow. The point is accessible at a very shallow level, meaning the leverage point at which the practitioner can affect the neurology, well, not their neurology, can affect the metabolism of the person, right? So how can acupuncture puncture a lung? Then simply the needle goes into the lung. If the needle goes into the lung, obviously there's a problem. But again, it's so rare. And even if it does happen, it's treatable with Western medicine. It's not a death sentence. How can acupuncture help cancer patients? There's a lot of research being done, and even some it's being used in hospitals. The research about it is still ongoing. There's not necessarily any conclusive like this can help cure cancer, this can help not cure cancer. Mostly you hear it being used for treating the symptoms and side effects associated with cancer and chemotherapy, or side effects of chemotherapy and the symptoms of cancer and symptoms of being on chemotherapy. My father went through that chemotherapy, cancer, a bunch of that stuff, and it's horrible. I would, I it's just it's such a tragic thing to watch and to be part of and have to witness, especially for families who don't know what to do, just by virtue of that, having been trained as a medical professional. So, there's a helplessness thing there. So, how can acupuncture help cancer patients? Peace of mind, literal physical reduction of pain in the body, optimizing the underlying metabolism. Why did a person get cancer in the first place, contract cancer in the first place? If it's from working in a factory every day and being exposed to certain chemicals, acupuncture might not necessarily can't help treat that, right? Unless that person's willing to leave that job or leave where they live, if they live in a toxic home or near a Superfund site or something like that. Or if they're, super high EMF area, it's been found that electromagnetic frequencies can damage proteins in the body, and it causes all kinds of weird cascades. And same thing with like Teflon and all these kinds of environmental toxins. If you want to call BS on the electricity thing, like that's fine. But enough electricity will damage proteins and functionality of the body and the body's ability to regenerate and reproduce. It's been proven in rats. So radio frequencies can produce cancer in rats. So again, how can acupuncture help cancer patients? Well, notwithstanding all of those environmental toxins, all the environmental factors, all the things from the environment. We live in a kind of a toxic world at this point. So it can help the underlying metabolism to process that kind of stuff, and can help in pain reduction, and it can help in the nausea associated with chemotherapy. It can help with the headaches. If you do it early enough, it can help with neuropathy, I believe. So that's just all of this. Again, another disclaimer. This is all super brief overviews. We could go super in depth into any one of these questions. Could be a 1 hour discussion or longer, or its own book, right? So can acupuncture help sciatica? Yeah. Sciatica pain for acupuncture is like one of its party tricks. Again, it's not a guaranteed cure for everybody. Again, cure. See, I got caught using that word. How can acupuncture help sciatica? So typically, if we're just talking acupuncture here, it's going to bring down, it's going to take the muscles that are surrounding the nerves that cause sciatica, which is kind of a broad non-medical term, out of the equation. It is inherently a medical term, I get that, but the way that it's used is colloquial, it's broad, right? So you say, oh, I have sciatica, numbness and tingling on the side of my leg. Okay, well, is it from compression of the sciatic nerve as it comes out of the low back, or is it coming through uh as the sciatic nerve drops down? You can look this up on the internet, the piriformis muscle, piriformis syndrome. The sciatic nerve runs behind that piriformis muscle, so it's a muscle kind of underneath the glutes. So if that muscle gets tight, then unfortunately that nerve gets impinged and creates that numbness and tingling sensation. So it can help with inflammation in that area. It can help move the muscles out of spasm. It can help with like histamine response and stuff like that. But also we want to address the underlying structure and address the underlying repetitive stress movements that cause that. Are you constantly picking stuff up? Do you have sciatica because you're, you know, you live a sedentary lifestyle? Do you have sciatica because X, Y, and Z, right? So how can acupuncture help with pain? It's really, really generic, but acupuncture, one of the few things that acupuncture is widely accepted for is its ability to help diminish pain broadly. Some people have idiopathic pain, meaning they're like, I got pain like in my body and I don't know why and I don't know how and I don't know what to do about it. And acupuncture has, shown some benefit in lots of that stuff. So again, a list of what can acupuncture treat, list of acupuncture, things that acupuncture can treat. Where to start on that? It depends. It's again, so acupuncture falls under traditional East Asian medicine, which is its own entire system of medicine. So China, in its various dynasties over thousands of years, relied on traditional East Asian medicine, their own medicine. They just called it medicine, and they relied on acupuncture as part of that medicine to treat everything. So there's acupuncture points to treat everything, to bring about pregnancy, to treat headaches, backaches, neck, shoulder, any body ache you can think of, any organ pathology that you can think of, uh, insanity, eye stuff, dentistry. They had dentistry in East Asian medicine, so we don't necessarily have acupuncture for for cavities, but it treats a lot. I would recommend saying, rather than looking up the list of things that it can treat, look up how it relates to your specific condition. Write down a list of the top 3, 5 conditions that you have. Can acupuncture help? Blank. How can acupuncture? I mean, the how is not really important. I think really the answer is can it help it? Find some proof on the internet of it helping it, and then look up somebody in your area. Call 1, 2, 3, 4, 5. However many acupuncturists you need to find, until you find somebody who can confidently say, "Yes, I've done that thing, and I know what I'm doing." And for some people, it may even be worth a 2.5 hour drive. Even if it was once a month or a 3 hour drive. However far the next nearest city is. So you know, sometimes we got to travel for specialists, and that's just the nature of the world that we live in right now. Until Jeff Bezos can figure out how to Amazon drone an acupuncturist to your house, that's kind of what we got to do. So, how can acupuncture be used for? A lot. How can it heal? A lot. Healing is a funny word too. Can acupuncture? You see, acupuncture doesn't heal. You heal. Your body heals. The body heals itself. The acupuncture facilitates the optimum conditions in the body for it to be able to heal at its most quick and most efficient rate, if you will. Rate, quality, all that stuff. So, what can acupuncture be used to treat? We talked about that. Can it help you with? What can it fix? When is acupuncture used? I guess that again falls under what things are we talking about here? Acupuncture. Okay, so acupuncture is so when that's a super broad question, but I'm not really sure what they're intending. Acupuncture is the way I'm going to answer is this: that the way that acupuncture is used in America as it stands in the moment, based on the way the modern medicine system is. It's 20. What year is it? 2022. It's September. The acupuncture is used as a bridge between I'm a healthy autonomous person and I don't need medical intervention, and I'm in the hospital. So when one goes to the hospital, there's oftentimes a lot of fallout, a lot of stuff that needs to be done to get back to, you know, game time strength again, right? Getting, maybe you break your leg, there's some recovery. Maybe you have a heart attack, there's some recovery. Maybe you have a spleen issue, there's some recovery. You go to the hospital, they tell you nothing's wrong with you, or they tell you something's wrong with you and they fix you temporarily, and then you leave, and then you have all this recovery to do. And acupuncture is really great at bridging that gap. And that's even, I spoke to a surgeon. She's not, an ER surgeon, and she said much the same. She's like, yeah, we don't, ER doesn't have a lot to to do in the way of prevention. They're the stop loss, the stop gap between you and the Grim Reaper. So acupuncture is going to be hugely influential in the next decade and the next two decades in terms of the overall health of, and my lifetime. I think it's going to be pretty massive. So that's cool. When is acupuncture used? We talked about that kind of. When does it work? When does it hurt? It hurts everybody. You're getting stabbed with a needle. It hurts. Any acupuncturist who tells you it doesn't hurt is lying to you and maybe doesn't know how to get acupuncture, or they're such a super good expert that they've figured out how to make it not hurt. But you're getting poked with a needle. It hurts a little bit. Doesn't hurt like getting a shot. Doesn't hurt like getting a injection or a vaccine or anything like that. It's totally different. It's way less. It feels like getting a hair plucked or a mosquito bite, something like that. And you only really feel that as long as the needle's being manipulated. After that, the pain kind of subsides, and it's just get this kind of euphoric sensation. Your mind feels good, your body feels good. You get this kind of like happy-go-lucky, easygoing vibe about you. It's really nice. Plus, also the thing, if they do it good, this if they do it right, it's not going to hurt as much as the thing that you're going in for, ideally. So acupuncture for fertility. When does it work? Well, at all stages of fertility, before you're trying to conceive, while after conception, uh, approaching delivery, postpartum, it's a really great thing to lean on during that. But you wouldn't necessarily lean on your IVF provider for postpartum. You wouldn't necessarily lean on your ER doctor for conception, right? It's the interesting thing about acupuncture is it's one of these threads of continuity that can take you from not pregnant to through the rest of your life. Honestly, it's good to have a good acupuncturist around, but to go through that whole process and have support through the whole way. I've never had a kid. I probably won't ever have a child from my, I'm just not anatomically built that way right now. So but if I were, and if I was going to, I would rely on that pretty heavily. So anyway, moving on from that crude imagery. When does it work? When can I get acupuncture? Can I exercise after acupuncture? Yeah, you can. Some people like to lay low after a day of acupuncture. Some people like to go to the gym and crush it. I think if you feel super tired, you should honor that and get some rest and not try to push the issue. If you're going for some physical pain, from overtraining or repetitive training, you might want to take a break afterwards if you can. If you're competing in something, it's case by case. Like I've had people come in, had athletes come in who really want to get up to speed. They want to get strong. They got a competition in 5 weeks, and they want me to fix all of their musculoskeletal pains. I'm like, how am I going to do that if you keep running on it? Fortunately, I've had great teachers, but the question part of that question comes back to, oh, just deleted something. Part of that question comes back to how important is the thing that you're competing for, and is it worth getting hurt over? So, can you shower after acupuncture? Yes. There's some recovery folklore. I don't even know if it's folklore. It might be scientific. It might be a thing. I think it's a thing, but they say don't take a cold shower after getting cupping done, because that kind of, your pores are open and the cold can get in. You can catch a cold that way, and I think there's something to be said for that. Where can acupuncture be accessed? There's a lot. There's 3 states in the United States that don't have licensure, so anybody who's practicing in that state isn't licensed. So that's kind of interesting. Um, It can be accessed at your local acupuncturist. Some hospitals do it. Some people do house calls, so lots of places. Where do acupuncture needles go for anxiety? Oftentimes the hands, feet, maybe the stomach. Maybe sometimes the people put one here to calm the mind in between the eyes. And you may be like, what? Needle between the eyes and the face? Trust me, you want it. If you have anxiety, you want it. It's like it's the panic button. It's the like easy button from Staples. Like they press that button, it's just like everything's cool. Nothing to worry about. Where do acupuncture needles go for versus sciatica? Sometimes in the hands and feet, but also sometimes in the low back and the glute. Where do the needles go for menopause? Hands and feet, sometimes around the tummy, sometimes on the back. Where do they go for neck pain? Sometimes they go in the neck. Sometimes they go in the hands and feet. We can talk about that. Okay, so we'll talk about that here now. Local distal, the idea of local distal. So in East Asian medicine, in acupuncture, there's this idea that the you can treat any part of the body through accessing it through the hands and the feet, mostly almost any part of the body. And also you want a needle kind of in the area of that pain. So if the pain is in your intestines, obviously we're not going to stick a needle all the way into your intestines, but we may utilize the large or small intestine channels which go to the hands and the fingers. So we might access it through the hands, the fingers, the forearm. For migraines, we might put some needles in the back of the neck, around the head, the shoulders, and some in the hands and feet to connect the distal, meaning far away, and the local, the close, the local points, right? Local to the area of pain. So if my head hurts, then a point in the head would be the local point. Okay, where are these acupuncture points? Heart 7 is here. Conception vessel 12 is on the stomach, halfway between the xiphoid and the belly button. What can acupuncture treat, list, heal, cured, used for? Weight loss, covered it. Who should not do acupuncture? Good question. There was a saying that people who they used to say, not that it was a saying, they used to say that people who had bleeding disorders shouldn't do acupuncture. That's been disproven. It's totally fine. People who have bleeding disorders can get acupuncture. Who should not do acupuncture? Hard to say. It doesn't agree with some people. It doesn't agree with everybody. I recommend most people give it a try, and since the risks are usually pretty low with it, so even if it doesn't really vibe with you, you might get like sick or nauseous, or some people just can't tolerate needles and they'll pass out. Like it's hard to say. Some people don't resonate with it. What can it help with? What can it not treat? What can it not treat? Heart attack. I mean, there's an acupuncture protocol for heart attack, and there's acupuncture points for heart attack. But if you're under these acute situations, uh, appendicitis, crazy weird infections, heart conditions, inability to breathe, referred pain down the shoulder and arm, gallbladder, right? Gallbladder attacks, gallstones, kidney stones, stuff like that. Don't go to your acupuncturist. Go to the ER first, right? Kidney infections, lingering bladder infections that won't turn to kidney infections. It's best to go get, antibiotics for that kind of thing, or go see emergent medical care for that. And then when that resolves, well, not even when that resolves, like after you leave, then you can go see your acupuncturist and set up a treatment plan and figure out, okay, how do I get from where I am now to where I want to be? So how do I find resolution? And that's going to be different for lots of people depending on what you're coming in for, how long you've had it for, how bad it is, how complicated it is. So I have people with some, 7, 8, 9 chronic conditions, and acupuncture can be of benefit to them. It can treat them, but it needs to also be addressed on other levels too by other specialists. Who's acupuncture near me? That's just a basic. Who's it good for? Talked about that. Who can perform acupuncture? They have to be licensed, at least in the United States. They have to be licensed. Chiropractors and MDs can do it, but I would not necessarily recommend that would be somebody's first choice because chiropractors have and NDs, they're allowed to practice under their license as long as they take like a 300-hour training course or less. Like sometimes people take like a weekend course and they're good. So it's like, yeah, most acupuncturists in the United States have like 2,000 hours of training. So I'm gonna go to the people who have trained for a little bit longer on that personally. Also, yeah, I'm not gonna talk about that actually. We're gonna move on. So who can perform battlefield acupuncture? Uh Acupuncturist. It's a battlefield acupuncture is a protocol. It's a series of 5 ear acupuncture points. I think if somebody's not a certified, they could probably do it. It you see it used. They use it on the battlefield. So I guess those are army people who are army trained in it. I guess technically anybody who knows the protocol can do it or who knows how to do it can do it. Um, but that doesn't mean they're necessarily legally allowed to under state and federal laws. Who should not do acupuncture? Some MDs, some chiropractors, and some physical therapists with their dry needling nonsense. Who should not do acupuncture? I think what they mean here is who should not go to acupuncture. We talked about that. Who can benefit? We did that. Why is acupuncture good for you? Treats the underlying metabolism, helps you get out of pain, helps optimize your body's energetic flow and its ability to heal of its own accord. So why do acupuncture? Because it's awesome. It makes you feel super great, and it's very, very high reward, very, very low risk. Why is acupuncture used? Because it's medicine. It's used to relieve pain and suffering. Why is acupuncture a pseudoscience? Um, because Wikipedia classifies it as a pseudoscience, I think. There's no talk text. There's no talk in any of the ancient texts that I've heard about it being a pseudoscience. There's thousands of years of empirical evidence. There's scientific evidence proving that acupuncture can work for lots of things. I don't know why that would make it a pseudoscience. So I don't think it is. I think it's just a movement to discredit acupuncture for the sake of cornering the market on sick people, and you know that's just a money move in my opinion. Why is acupuncture effective? Because it's real and it works. That question I think is might be a little bit better answered case by case. Maybe somebody else can speak to that better than I can, but there you go. Why is acupuncture painful? Because you're being stabbed. Why is acupuncture good for pregnancy? It can help with the So before trying to get pregnant, it can help increase the likelihood of pregnancy through optimizing the uterus and the attendant organ functions and hormonal cascades that are associated with that. And leading up to it, leading to higher likelihood of implantation and conception and likelihood of keeping that pregnancy goes up and smooth delivery, like we talked about. Lots and lots of reasons. Why is it done? Not going to answer that. Will acupuncture help sleep? Definitely can do that. Will acupuncture help nerve pain? A lot of times, yeah. A lot of times, yeah. I'd hate to say that there's an always. I mean, I would say if you were that person, or if this resonates with you, can it help? If you're asking that question, I would say start reaching out to some acupuncturists and say, maybe not will it, but which acupuncturist can help my nerve pain? Maybe that's the better question to ask. Can acupuncture cause cancer? I'll eat, as my mom would say, I'll eat my hat. I'd eat my hat if acupuncture can cause cancer. I don't think so. I've never heard of that happening. Will acupuncture help a trapped nerve? It can. And again, the question there is which acupuncturist can help me with this trapped nerve? If it's trapped nerve between bone, trapped between bony landmarks, you might need a chiropractor to help, or a bone setter like myself. Like I do physical manipulations of bony tissue. It's covered under my license, and I'm trained to do it. And it helps free trapped nerves. If the nerve is trapped with musculature, then acupuncture is super, super great for that. Well, acupuncture leave you tired. Yeah, definitely. That can cause tiredness. Sometimes that can be a sign of overstimulation, or sometimes that could be taking this kind of like go, 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 go edge off of you. Like, oh, and you unwind that, and then you're like, oh man, I'm so tired because you're feeling how tired you actually are. Can it make you feel, oh yeah, can it make you feel sick? Yeah. Yeah. It's a medicine, and any medicine has, medicine has consequences. And we try to mitigate the negative consequences as much as possible, but doesn't mean it will make you. Oftentimes, if it makes you feel ill, like sick, nauseous, overly fatigued, it could have been an overstimulation, which could mean that you are run down. It could mean that you are very, very sensitive, and maybe you need to bring that up to your acupuncturist. Say, hey, I'm super sensitive, and I feel like I felt super like if you feel these things, ill, like nauseous, heaviness sensation, like I just can't get up or I need to lie down, like now, that kind of thing could be a sign of overstimulation, like as if you got quote unquote overdosed by the acupuncture. So I wouldn't worry about it, but it can happen. Acupuncture for weight loss, yes. Does acupuncture for fertility work? Yes, scientifically proven. Which is a funny thing to say because studies can be used to prove whatever they want, but it's been used for thousands of years. It does work, and science is catching up with the fact that it does work and finally becoming able to prove it. Does it work for anxiety? Yes. Does it work for back pain? Yes. Does it work for migraines? Yes. Is acupuncture everybody dang close to it? Not for everybody all the time, but for most people, a lot of the time. Does acupuncture for tinnitus work? It can. The sooner you do it, the more likelihood you have of it working. If you wait too long, it's going to be less likely to work. Does acupuncture for sciatica work? Yes. Can leave you tired, tiredness, make you feel ill, irritate the nerves. Yes, cover that. Acupuncture at home. Da, da, da. There's a lot of people inquiring as to where and who does it. Can acupuncture induce labor? Yes. Does acupuncture to quit smoking work? Yes. Can acupuncture help to lose weight? Yes. Use it yourself? Yes. Can acupuncture be done wrong? Yes. Who should not do acupuncture? Most people who aren't acupuncturists. Do's and don'ts of acupuncture. That's too much to talk about. Can acupuncture help with weight loss, anxiety, back pain? Okay, we're getting there. Can you practice acupuncture without a license? In those three states, you can that we talked about. Can it be done without needles? It's called acupressure. Can you do acupuncture without needles, without a license? And can you do it without? You can do anything illegal that you want. Doesn't mean you should. Doesn't mean laws isn't necessarily the thing that stops people. Who should not do acupuncture? You, if you don't know what you're doing, if you don't have a license, if you've never been trained, because you can hurt yourself and you can hurt somebody else. So if you're not trained, you're not licensed, don't do it. So this is interesting. A lot of the same questions: weight loss, anxiety, tinnitus, neuropathy, sciatica. Like again, we talked about that can help as long as you find the right person. Can acupuncture work like Botox? Yeah, acupuncture. Can it work like Botox? No, it does a completely different thing than Botox does. The pathway that it works is different. Can it help you make you look young and vibrant? Yes, there's actually this story. I used to work in a clinic and in New York City where they did facials. And there was one woman who was coming in, she was in her 70s, she's coming in regularly for facials. And she was getting some results. I took a leave of absence from that job for a couple months, tried to get caught up in my life, and then I went back. Hadn't seen that woman for a while. Then she walked in and I did not recognize her. She looked so young. Her skin was tight and supple. She looked young. She looked vibrant. She looked like confident. She looked like a completely different person. And I even asked the guy I was working with, I was like, who's that? He's like, you know who that is? He told me who that was. I was like, no, that's not her. It was. So acupuncture facials work like magic. Acupuncture cause flu-like symptoms. Yes. If you're overstimulated, yes. Yes, it can make you feel worse. Yes, it can aggravate your symptoms if done incorrectly or if done to excess. It can be done in children. Definitely done with children. So, can it affect your bowel movements? Yes, it can move your bowel movements for you, or it can astringe them if they are moving too much. Can it affect your menstrual cycle? Yes, another party trick. If your menstrual cycle is not moving, it can move it for you. It can help you regulate that. Can it aggravate symptoms? Yes. Again, we said if it's overstimulation, it can cause a problem. Can it affect your mood? Yes. Oftentimes people will feel an evenness come back to their mood, lower, higher lows and lower highs, right? Kind of bringing those oscillations, super high, super low, bringing them more into the middle where we just kind of feel good about stuff. Like good, I don't want to use the word good, but you feel like things are all right. You feel like things are good. You feel optimism. You feel un, not afraid. Like you're good. Can acupuncture affect blood pressure? Yes, I'm going to leave off on this note, and then we'll come back to this another time. Can acupuncture affect blood pressure? I had a patient come in with somewhat high blood pressure. I'm treating him now for high blood pressure. It was in the 150s, and his acupuncture, his blood pressure while we were treating him in the treatment, dropped about 15 points, right? Maybe 20 points. And after one or two, maybe three treatments, his baseline blood pressure was about 20 points lower in just a few treatments, two, maybe three treatments. So it would be great to see him come off. He's only on one medication at a very low dose, so we'll probably be able to get him off of medication. And he won't have to worry about the long-term side effects of that medication once we take him off and once we start to undo some of the damage done by that medication. The medications like blood pressure medications are meant to be a short-term interruption of the cycle of high blood pressure. Over time, the body will compensate by raising the blood pressure to catch up to it. It's meant to be an interruption, interrupting what's going on. And, us saying, okay, like if you have blood pressure so high that it's causing an immediate risk, like you're going to have you know, burst blood vessels in your brain or something, becomes a life-threatening high blood pressure situation, then it needs to be, it needs medical intervention. Medication is a good starting point, but these medications aren't necessarily designed for somebody to be on for the rest of their life. Somebody might tell you otherwise, but that's not been my experience. And if you read the side effects associated with a lot of these drugs, it doesn't look like something that you want to be on for a long time. And it might help to, if you're on high blood pressure medication, it might be a good idea to look at that and say, what are the potential long-term side effects of that? And does that outweigh chocolate cake and not exercising? Like, should I keep eating chocolate cake and not exercising? Or should I maybe try and regulate my diet a little bit? Should I embrace a more active lifestyle and get off of this medication with the help of supervision of professionals who know what they're doing? So I'll leave you with that. Can definitely help super, super almost shockingly good with blood pressure and with mood and stuff like that. So I hope this is helpful. I hope this speaks to somebody. I hope this lands true. And we only got about halfway through, so sorry about that. Maybe we'll pick up part two later. I hope you love it. I hope you find it helpful. Thank you so much for listening. My name is Dr. David Santander. I work here in Kailua with our practice that we created. It's called Oahu Holistic Medicine. We also have a nonprofit called Oahu Community Medicine. So thank you for talking to us. Thank you for connecting. Talk soon. Bye bye.